And for our first story, the Ghana National Association of Teachers, NAT, well, they've warned government to keep its hands off the management of pension contributions of its members, else they will hit the streets. A 5-year strategic plan to fight neglected topical cases launched in Ghana. And we're also going to have a lot more details. Now, we bring you the news in detail. The Ghana National Association of Teachers has warned government to keep its hands off the management of the pension contribution of its members, else it will hit the streets. Deputy General Secretary in charge of Administration and Labour Relations at NAT, Awatrin Kansa, has asked government to prioritize the transfer of pension funds to the pension schemes operated by individual labour unions. Under Ghana's new pension law, the National Pensions Act 2008, Act 766, workers have a 3-tier pension scheme. The second-tier occupational pension scheme is mandatory for all employees, but is privately managed and designed primarily to give contributors higher lump sum benefits than presently available under the Social Security and National Insurance Trust SNIT or CAP 30 pension schemes. The Minister of Education has justified the allocation of funds from a World Bank loan to distribute sanitary pads to female students in deprived areas of Ghana. Professor Jane Nana Opoku-Agyeman says, contrary to reports making the rounds, only a small fraction of the $156 million will be dedicated to sanitary pads distribution to young girls.
To primary education becoming almost universal in Ghana, new priorities are emerging at the post-basic level, where the demand for secondary education is fast increasing. The supply of senior high schools has, however, not kept pace. Ghana's middle-income status will require more senior high school graduates with the relevant skills and abilities to either further their education or join the workforce. Research indicates a lot of the youth typically would either not have physical access to a senior high school or do not qualify to gain admission. In addition, the quality of senior high school programs shows large disparities between the best performing schools and the rest of the sector. At a news conference in Accra, Minister for Education Professor Jane Nana Opoku-Agyeman believes the secondary education improvement project is very crucial to addressing the challenges.
And this is a project that looks at results. So we are going to track the results as we move along. Are the interventions yielding any results? If so, what are they? What should we know? What should we be doing? And this is why research is also very, very important. It has to be ongoing. And all of this will advise the ministry in ways that are very, very objective, give empirical data based on which we can propose interventions.
She stated the sanitary pads are aimed at improving sanitation among adolescent school girls. Girls, she says, are often forced to skip class during that time of the month.
It's a very, very serious issue. And I really implore all of us to handle it with the sensitivity that it requires. If that is the reason why she's not coming to school, because she doesn't have what to do, what to use, and she doesn't want to be sold and her friends laugh at her, we don't think that's enough reason why she should stay at home. It's not an illness. It's not anything to be ashamed of. There are ways to help you take care of yourself when this happens, a very normal thing for women. Okay, so we really implore everybody that we don't downgrade it or think that it's a waste. Is not a waste, especially when you see, and there are case studies in other countries. Okay, Uganda is a case in point.
Touching on the POTAC strike, Deputy Minister for Education Samuel Okudzeto-Ablakwa says even though government has limited resources, the book and research allowance being demanded by the union is not in arrears.
The POTAC strike action has come about, and I think that it is important that we clarify some issues, because we have been listening to the discussion and monitoring media commentary, and the impression has been created that government is in arrears or government has refused to pay for book and research. The book and research allowance, and this point is very important, is paid once a year. The impression out there is that government is in arrears or government has refused to pay. That is not the case. As we speak, the government of Ghana does not owe the lecturers of Ghana in terms of salaries and other working conditions.
Members of POTEC have abandoned the classroom over government's decision to do away with the book and research allowance for the newly established National Research Fund.
Meanwhile, the ranking member on Parliament's Finance Committee, Dr. Anthony Akutuose, has questioned the sustainability of the sanitary pad distribution initiative government is contemplating as part of the secondary improvement project. Some $15 million of the $156 million World Bank loan will be used to purchase sanitary towels to be distributed free of charge to female students in some identified deprived areas. Though he lauds the initiative, he believes government should consider alternative sources of funding to sustain it beyond 5 years. He also criticized the approach adopted by Parliament in approving the loan and urged government to return it to the House for further deliberations and discussions.
Sanitary pads is not an issue. I think we should get it right. We are not complaining about sanitary pads. It's a health issue. The main issue was whether or not we are getting value for money on the amount going to research, monitoring, and evaluation. You see, you are going to borrow money and you spend 10% to do administrative things. Changing the face of 75 schools costs 9 million. The research and monitoring is by itself 15.9. We think that they should spread it among the existing schools to rehabilitate. You get more value for money. As to the issue of sanitary pads, we think that borrowing money to go there is not the way. It's not sustainable. So what happens when the loan expires? If it's a good policy, you can even tax alcohol, cigarettes and alcohol for that purpose. Then you'll be killing two birds with one stone. I think the government should revisit it and in any way, if I were the government, because the vote was not by consensus, they should be worried that the World Bank itself will be worried about it. So this is something we have put on the table. They should look at it. We talked about such things in the STX, CDB. They didn't listen. They should listen.
Well, let's turn our attention to some other news. And the National Coordinator of the National Disaster Management Organization, NADMO, Kofi Portofe, has called for the establishment of a National Disaster Fund to enable the country deal effectively with future disasters. He suggested that at least 1 to 3% of the national tax should be used to establish the fund to enable donor partners channel their allocations into the fund to bring about a holistic approach in combating or dealing with disasters. Mr. Portofe said this when the NADMO Hydrological Technical Committee members toured some five flood-prone communities in Accra to enable them assess the problem and find out what post-flooding activities to prioritize and also how they can act on some of these difficulties. He said national disasters are beyond individual ministries and budgets, but if the fund is created, it could cater for that. According to the national coordinator, Accra has 31 flood points, and all these points get flooded during the downpour as experienced the last couple of days. He blamed the Accra floods on several engineering mistakes and called on the Department of Feeder Roads and Urban Roads to ensure that these mistakes are corrected to avoid future floods. The Ghana Water Company Limited has allayed fears of consumers over a recent announcement of 6.1% tariff increment in water. According to Chief Manager in charge of Public Relations, Michael Ajimine, the increment is insignificant since Ghanaians would by charge only 1 pesewa per 200 gallons of water. He noted the increment is just 0.8% from 1.38 Ghana cedis to 1.46 Ghana cedis, adding consumers should not panic at all. The GWC says post-paid customers would only see the new charge in the first week of August when they receive their bills. The PRC last week announced a 6.1% increase in water tariffs for the third quarter of 2014. The new tariff took effect on 1st July this year. The Ghana Right to Information Coalition has been charged to create a reliable data archival system and intensify advocacy to pep up public interest in understanding the benefits of the Right to Information Bill. This was after lack of public interest and poor record keeping were identified as major factors accounting for undue delay in the passage of the bill into law. AU Special Rapporteur Pansi Tiakula said Parliament had assured the bill would be passed into law by 2016.
In Africa and beyond, the right to access information has gained wide recognition as an indispensable feature of a functional democracy, since information generally serves to enlighten public participation, build popular confidence and promote democratic empowerment. In 2003, the government of Ghana prepared the first drafts of the Right to Information Bill to give effect to the constitutionally guaranteed fundamental right to information. Following some degree of consultation with civil society, the bill was finally laid before the 5th Parliament on Friday, February 5, 2010. The failure of that Parliament to pass it, despite all the deliberations, however, meant it had to be taken through the process again by the new set of MPs. While the Coalition on the Right to Information Ghana recognizes that the provision of the bill are a fair attempt to meet international human rights standards and best practice, there are still areas that are in critical need of review in order to bring the bill in line with international standards on the right to information legislation. At a conference in Accra to discuss an AU model law to break the barriers of the right to information, African Union Rapporteur Pansi Tiakula highlighted how the model will better enhance Ghana's right to information bill and disclosed Parliament will pass the bill into law by the end of 2016.
We had a conversation with the authorities. One of the issues that they raise is what we have already mentioned, that there's no demand for information. Ordinary people, even academics, we're told, even academics are not aware of this law, and there's no need really for it on the ground, but that there is a commitment to pass it. I did ask a pointed question, as my colleague Chibuzo has asked, to say, can we get an indication of when the bill is likely to be adopted? Pointed question, and we were told in the 5th term of Parliament, which ends when? 2016. So before 2016, we're given an assurance that the bill will be passed.
She also touched on the need to intensify advocacy to make the citizenry understand that the benefits of the Right to Information law cut across the entire social spectrum. A Nigerian associate legal officer at the Africa Regional Work of the Open Society Justice Initiative, Maxwell Kadiri, cited unwillingness of African leaders as one of the barriers to the Right to Information bill and advised civil society organizations and other stakeholders to keep their commitment to the bill alive to ensure it does not become an exercise in futility.
People have skeletons in their cupboards, and more often than not, no government wants those skeletons to be out because of the potential negative effect it has on the goodwill that it has in public. But what you find is realizing that there are legitimate exemptions, of which national security is one, but national security in a very defined sense, and not national security as personal security. My heart was gladdened when we were told by the minister yesterday that one of the things that was on the demand for Occupy Flagstaff House was pass the ATI bill. You need more of such Occupy movements. Maybe not to occupy Flagstaff House, but if you even to occupy the councils, if it's to occupy governance at that level, where people begin to know that we can make demands on these people because they have a responsibility to provide these services for us. And I tell you, if that happens, Parliament will no longer tell you that the people are not demanding access to information.
He also advised Ghana to clearly state the parameters that define national security, since issues about national security are likely to be exempted in the law. Other representatives from South Africa and Nigeria urged Ghana to draw lessons from the country's experiences and further called on the coalition to engage authorities consistently. Ridwan Karim Dini Osman, Joy News, Accra.
The Municipal Chief Executive of the La Dadekotopo Municipal Assembly, Rita Odole Soa, says her outfit will arrest anyone who is caught defecating along the beaches of La.
But as an assembly, we have planned to organize swoops for open defecation. And that one is going to be a serious one. And we'll showcase them on TV and then in the newspapers for people to see, because open defecation is a bad thing. So we are going to organize swoops on open defecation. So those watching me, soon they'll see us, the police, the military, the assembly together. We'll organize the swoop for open defecation, because you go to certain areas, it's not just the beach. There are big drains there. Even there's one at the cemetery here. And then people are just doing their own thing in them. So we go in there, arrest them, and prosecute them. And for the community, I want to assure them that I think the signboards are almost ready. We'll be mounting them there. So you have no excuse. Because we arrest some people, we have a court here, we bring them there. They are fined. If you are not able to pay the fine, the courts, you pay the fine or otherwise.
Outgoing Health Minister Shariati has launched a 5-year strategic plan to fight neglected tropical diseases. Well, this is what she terms a master plan, and has an integrated budget which will ensure that tropical diseases are eradicated from Ghana by the year 2019.
According to records from the Ghana Health Service, 8 out of 10 regions of Ghana have reported cases of neglected tropical diseases such as elephantiasis, onchocerciasis, hydrocele, Buruli ulcer, and several others. The neglected tropical diseases are a group of 17 parasitic and bacterial infections that affect over 1.4 billion people worldwide, WHO reports indicate. These diseases are most prevalent in Africa, and Ghana is no exception. Health Minister Shariati, after launching the 5-year strategic plan, mentioned the plan would, after 5 years, ensure that Ghana is not mentioned amongst countries with such diseases.
We want to assign community nurses and midwives to these community health centers, which we call the CHIP centers. And then we also want to introduce what we call record keeping. Our community nurses will visit households. You know, this is part of primary health care. At the same time, it will also help us with eradication process. Because when a community nurse visits a household, as we are going to introduce the new record data book, I mean, the nurse will be able to identify in every household what is wrong with everybody. So there's no longer the fact that you have to cover yourself with a cloth because of stigmatization. We at the Ministry of Health, we are chasing you to your house to make sure that we eradicate every disease within the community.
Ambassador for the project, Joyce Ayi, is calling on all to participate in the fight against these diseases.
If we can create conditions where people will not have to have direct contact with these water bodies, and maybe for the children, if they can have water, potable water, that they'll be able to use, then we will eliminate this. The Ministry of Health is a ministry that should be allowed to integrate the work it's doing with all other ministries. You know, our greatest asset is us, the people. And if we're healthy, if we don't have to deal with endemic diseases, if we don't have to deal with diseases that actually stigmatize us, disable us, and actually make it impossible for us to function as decent human beings, then we have a problem.
The master plan spells out the vision, mission and strategic direction of the NTD program of the Ghana Health Service based on the 5 pillars of the Ghana health sector.
And that's it for the news. Next, we'll be having in the studio Benedict Owusu to bring us the details of sports. And it's up next. You stay on.